Welcome back. We have been down this road before just over a century ago, and it's clear that policymakers are taking into account the lessons of the Spanish flu pandemic of 1918. Dr. Alex Navarro is with the Center for the History of Medicine at the University of Michigan. He joins us from Ann Arbor. So again, how many people died in that pandemic, and how long did it last?
So we don't really know for sure how many people died. The best estimate that we have is about 650 to 675,000 Americans, and perhaps as many as 50 million people worldwide. In terms of how long it lasted, there were four waves of the disease. The first wave came in the spring of 1918. It wasn't particularly deadly. The second wave was the deadly fall wave of 1918. That's the one that everyone remembers. The third wave followed right on the heels of that, came in the winter into the early spring of 1919, and then there was another wave in 1920. And after that, it attenuated and became background seasonal influenza for several decades.
So how did cities respond, and what were the lessons learned from that period?
Well, you know, we've learned, what they're learning is that from the experience of 1918, we know that cities that implemented these, what we call non-pharmaceutical interventions, these social distancing orders, when they did so early, when they layered them, so they had multiple closures of schools and businesses and public gathering bans and churches and all of those things, and when they kept them in place for a long time, those cities fared better than cities that either acted slowly, did not layer, or remove those orders too soon.
How did Los Angeles respond, and how was it different from how San Francisco handled the pandemic?
Absolutely. So Los Angeles acted very quickly. The health commissioner there, Powers, and the mayor, Woodman, they got together very quickly when they realized that the epidemic was starting to move across the United States. They convened a special influenza advisory board that immediately went into action. The advisory board decided that closure orders were probably a good way to at least mitigate some of the deadly effects of the pandemic, and they put those orders into place very rapidly. So we measured in our study, we measured the number of days that these non-pharmaceutical interventions were kept in place. We measured how quickly cities reacted to their own epidemics, and then we measured the excess death rate as a result. And just to give you an example, contrasting Los Angeles with San Francisco, San Francisco had about half or less than half of the number of these NPI days. That's how long they kept them in place. They reacted twice as slowly. And as a result, they had a significantly higher excess death rate. It was 673 people per 100,000 in San Francisco died as a result of influenza. In LA, it was 494 per 100,000. San Francisco had one of the worst outcomes that we studied in the United States. It wasn't the worst, it was about the fifth worst. And LA was about in the middle of the pack.
So LA stayed locked down longer, San Francisco opened up sooner.
They did, excuse me, in terms of their own epidemics. So we have to remember that each city had its own epidemic with a slightly different start and end date. But they did come out of it sooner. They removed the closure orders sooner. And right at the tail end of these closure orders, they decided to implement a mandatory masking order, which initially there was some compliance to, but people started to push back against it. These masks were uncomfortable. They were using gauze masks at the time. And when the epidemic came again, that second spike into that third wave of the winter of 1919, Los Angeles, for example, closed its schools again because they had an outbreak in the schools. San Francisco went with a mandatory mask order, and there was widespread noncompliance. In fact, so many people were angry about it that they formed an anti-mask league. And we know of at least one example where over 2,000 people gathered to protest wearing the masks, and none of them had masks on. In fact, earlier, when the first masking order was in place, the mayor and the health commissioner were caught without their masks at a boxing match after the city had reopened. So there was widespread noncompliance with this mask order in San Francisco.
And we should point out that, like now, it was largely a local issue.
President Wilson never uttered a word publicly about influenza. About the pandemic. He was primarily concerned with prosecuting the war effort, World War I. All of the work in controlling the epidemics all happened at the state and municipal level.
And once again, based on the history, the second wave of that virus was the most deadly. Is that something we need to consider with this crisis?
Yes, and I'll say this. So we found across many, many cities that when these closure orders were lifted, people flocked to downtown entertainment districts. We saw in city after city people lining lining up to go to movie houses with lines around the block, to go out to cabarets, to go to sporting events. Now you have to remember, this was wartime, and many of the cities reopened right on Armistice Day of November 11th. So there was a double celebration, if you will, celebrating the end of these closure orders and what they thought was the end of the epidemic, as well as the end of the war. So lots of people went out and congregated, and undoubtedly that helped continue to spread influenza throughout the rest of the fall and into the winter. We didn't directly study the economic impact of the epidemic, but people have since used our work to study the economic impact. And the research now seems to indicate that cities that implemented these social distancing orders in a way that was, at the time, perhaps a little more onerous, a little stricter, in fact, had a quicker and more robust economic recovery after the end of the epidemic.
Yeah, that's something to learn from. Dr. Alex Navarro of the Center for the History of Medicine at the University of Michigan, thank you for taking the time.
Thank you. Thank you. You too. Thank you.
We'll have some final comments after this.